Hey everybody, my name is Damon.
My name's Adam.
We both are student nurse anesthetists, and today we're trying to implement our DNP project about exploring the CRNA profession. Hopefully, our DNP project can bring the interest of you guys, the future nurses, to pursuing CRNA profession, and hopefully can addressing some of the anesthesia shortage we're currently facing right now. So I'll start off with why is this DMP project matters. So as you can see, everything listed on here, demand is rising with older, more complex patient population and the growth in the procedure area like GI and IRs. Rural and underserved communities especially depend on CRNAs. Many critical access hospitals cannot run OR without anesthesia providers, and CRNA providing 80% of the anesthesia in the rural places. Evidence has showed CRNA deliver high quality, safe care, and also cost effective. We're helping the hospital avoid cancellations and keep the OR running. Um, you can see the last one that I bolded, which is shortage of anesthesia providers. When you look at this chart over here, the need for surgical services from individuals 65 plus is projected to increase from 31% to 39% by 2034. The average age of anesthesiologists was 52.6 years old in 2020. 45% of anesthesiologists were older than 55 years old in 2020. The average age of CRNAs is 47.5 years old, and 12% of the CRNA report to plan to retire in 2027. So you could imagine that we have older and older anesthesia providers, but we do not have any younger CRNAs coming up. So now we are creating this shortage gap. 10% of the employment growth is projected for CRNA from 2023 to 2033, resulting in 5,200 new jobs openings. What is a CRNA? CRNA stands for as a Certified Registered Nurse Anesthetist. We're the one who leads the anesthesia in the OR. We do pre-op assessment, and then we create an anesthesia plan. We do induction, maintenance, emergence, and PACU handoff. We're also being called as airway expert. We will manage the ventilators. We choose the right ventilator mode for the patient. We provide vasoactive medications to support their blood pressure. We give their blood, we give their IV fluid. We also manage any crisis that's happening in the OR. Besides all this, we're also doing many other procedures such as epidural, spinal, peripheral nerve block, thereby to create a multimodal pain strategy on top of all the opioid medication we give to the patient. There are currently 27 states where CRNA can practice independently, and these are called the independent practice model. We also have collaborative model where CRNA working collaboratively with the anesthesiologist, and there's also ACT model where CRNA work under the supervision by the anesthesiologist. Despite all these kind of models, CRNA are allowed to practice in all 50 states in the US. We provide anesthesia to patients with all ages, from infants who just born in a couple of days until patient, who is geriatric patient, the elderly patients. We provide routine anesthesia up to high acuity critical care cases. So where CRNA works, we can work in the hospital, in the ambulatory surgery centers, in the OB, L&D, procedural suites such as endoscopy, cath lab, EP lab, IR, MRI, office-based anesthesia such as dental office, plastic surgery centers, GI clinic, pain clinic. We also working independently in the military, in the VA hospital, in the federal facilities. We work in the rural hospital, as I mentioned earlier. We can do trauma, cardiac cases, neuro cases, and the pediatric cases. So this just trying to introduce you about a CRNA, what typically they do during the day. Typically surgery starts at 7. We'll be in the OR around 6:30. We'll look at patient's chart. We'll do a pre-op assessment. Then we'll set up the room, make sure anesthesia machine is checked, make sure we choose the right drug to give to the patient, make sure we have all our airway equipment, and we also always have a plan B, the backup plan. During inductions, we'll bring the patient from the OR, from the pre-op to the OR. We'll intubate the patient and hook patient up on the ventilators. We can decide to if we want to give another IV, if patient require arterial line for this surgery, if patient need central lines. We are basically making all these decisions, and we're capable of doing all this. During maintenance, we'll make sure patients are hemodynamically stable. We'll give patient IV fluid if they need it, give them blood, give them any vasoactive drugs, and also if they need any additional labs during the procedure. And then we can also choose to if we're going to give any further pain coverage, such as giving them a peripheral nerve block, or giving them any additional opioids. And then we'll wake patient up and safely transport them back to the PACU and give you PACU report and also giving any additional orders that the nurses are needed. My partner Adam is going to introduce you about the education pathways.
So the education and admission snapshot. The pathway starts with a BSN and a competitive academic record, then at least 1 to 2 years of a high acuity ICU where a CCRN, ACLS, and PALS strengthens your application. Programs expect a CRNA shadowing, strong references, and an interview. The DNP NAP is about 3 years, mixing advanced sciences, regional anesthesia, and 2 to 3,000 clinical hours across specialties. Graduates then sit for the NBCRNA exam, obtain a state APRN CRNA licensure and hospital privileges, then maintain competence through the CPC program and ongoing continuing education. Developing strong communication skills, emotional intelligence, and being able to receive constructive criticism goes a long way. Applicants with strong backgrounds, resumes, educational experiences, and shadowing will be selected for an interview. Interviews will evaluate ability to think under pressure, evaluate maturity and readiness to get through school, and determine communication skills and critical care knowledge. Career outlook and rewards. CRNA practice offers autonomy, meaningful patient impact, and opportunities to lead, teach, or specialize. It's demanding but incredibly rewarding. The outlook for CRNAs for the next 10 years, as Damon previously mentioned, predicts a 10% projected job growth due to the increased demand for surgical procedures and independent anesthesia providers. It is also expected to grow due to the increase in aging population and the need to provide this population with more surgeries. This will make CRNAs very marketable and the opportunity to work virtually anywhere they want. Myths versus facts. A few misconceptions. Many people believe that CRNAs only follow orders. This is a myth. CRNAs can practice independently without supervision of an attending doctor. CRNAs are trained to be at the top of their license and even in supervising environments must be able to make proper clinical judgment without an attending physician present. Many people believe that in order to go to CRNA school, you must have years and years of critical care experience. This is a myth. The fact that matters most is the quality of experience you get and having a deeper understanding of patients' conditions and the medicines you give them. Also, having emotional intelligence is very important for being able to navigate the stressful environment of being in the operating room. So now you might be wondering how to prepare. You should now focus on sciences and critical thinking, shadow a CRNA, network with mentors, and explore leadership and research opportunities. Look at prospective schools, requirements, and what each school has to offer. Once you are a nurse, it is helpful to seek out challenging patients who are very sick, requiring you to think critically. Thorough understanding of pharmacology and knowing the reasons why certain interventions are being done over others. Knowing your patient's medical conditions inside and out helps you understand things on a deeper level and prepares you for CRNA school. Becoming familiar with ultrasound, how it works, and how to place IVs using ultrasound will set you apart. These steps strengthen applications and help you decide if this profession will fit you. So now here's a list of resources that may provide additional information about the CRNA profession, national and state organizations, and a link to CRNA Prep School Academy, which helped me navigate the requirements and prepared me for the application process. The AANA is the National Organization for Nurse Anesthetists, and the VANA is the State Organization for Virginia Nurse Anesthetists. These are good sites to help you understand current events affecting nurse anesthetists. This concludes our educational video. If this sparked your interest, I recommend navigating to the resources slide and taking a look at the websites we've provided. This will help you prepare to become a CRNA. Please take a moment to take the post-educational video survey, which can be found at the bottom of the email. Thank you for your time.